Thanks for staying. So the National Association of Resident Doctors, NARD, and Association of Nigerian Resident Medics recently embarked on an indefinite strike, paralyzing medical services at public hospitals in Nigeria, leaving hundreds of patients unattended. The question therefore is, with insurgency, insecurity, ethnic differences presently ravaging the country, should Nigerians support this strike? What are your thoughts on this? You can call us on 081-270-53687 or 091-390-76948. You can also tweet us at TVC Connect. Please hashtag your TVC so we can read your tweets. All right, so ladies, we read it in the papers today that even the NARD are saying that all the doctors that are taking care of the COVID patients must join the strike. If not, they're going to also they're going to fine 5 million to the chapters, the local chapters. Now that means they mean business. So they're saying that everybody should down tools, and it seems like some others are not complying. What are your thoughts on this? We're going to hear your views, and then we'll hopefully bring in somebody who can tell us exactly what the update is from their own end. What are your thoughts? Let me start with you, BC.
Yeah. So I think we need to stop just paying lip service to solving problems. Because I remember that in June 2020, September 2020, these same resident doctors down tools and went on strike. So what happened between September and we're in April now? That means nothing was resolved. And last week here, we're saying that they had a meeting with the minister, and they had to sign a memorandum. And then the minister was saying after they had signed, they had agreed, they reneged on their agreement, and they went ahead to carry out the strike. But these people are saying that we can't keep signing and going back to work, and then nothing is done. They just have a few requests that they are making to the federal government. They are saying that their hazard allowance, you need to increase it to at least to 50% of our consolidated basic salary. Just increase it for us. They are saying that the health insurance, life insurance scheme that you started, you need to enforce it. We've lost people. People have died during COVID-19. Doctors have died during COVID-19. Till now, their families have not received anything in form of compensation. They are saying that the arrears that you are owing workers, you need to pay them. Some of them are even saying that most of them have not even been paid for a couple of months now. Now, the health sector is a very critical sector. We are in the midst of a pandemic. People are dying, and it's not just COVID-19 that's killing people. We have other ailments that people are dying from every day. Now, if we continue to have our workers, people who are supposed to take care of those ones who come to get care from them, not being taken care of, what incentive would they work with? How would they continue to do their jobs better? We do not have options to travel outside the country to get treatment. This is all we have. The government needs to sit up and pay attention to the health sector.
Right. What are your thoughts on this?
So, for me, this is a case of somebody old pots. Somebody is supposed to feed baby. So one person is holding on to the plate while one person is holding on to the pot. Now the child is suffering because the person holding on to the plate decides that it can't be empty and I'll be looking for what to put inside. Somebody has to serve the main dish. The federal government are aware how serious this pandemic is. And we've always talked about how they pay lip service, how we wonder when the standards under the guidelines for COVID changes when it comes to government and officials and politically exposed persons. Now we see it clearly, because even if the issues that the Resident Doctors Association are highlighting are the flimsiest of reasons, at this time is when they could get away with anything. At this time where they are the warriors in the front lines, this is when they can get away with anything. And this is the time when we see the Minister for Labour come on national TV, and I wondered whether he was, whether he cared at all. I listened to his interview on TV, his countenance, his composure and everything, and I wondered whether at all he knew what we're talking about. You will not have patients who have, simple cases get to the general hospitals and they're just sitting there helpless. And the kind of care they need, they cannot afford it in a private hospital. No, there's no way. They would rather go and take number 160 in a general hospital and wait their turn till they get to that 160 because that's what they can afford.
When we were having to have this conversation, I was actually just tired. I'm like exasperated. I'm tired of having this conversation over and over again. These are critical sectors: education, healthcare. You know, these are sectors where people are involved, lives are involved. These are sectors where you expect that the government is making sacrifices. And in fairness, they try to make sacrifices in certain areas, but the truth is that it's still not enough. And you can't. And it's also it's something that's happened over time. It's not just something we're seeing today. And I feel that there's really there's no solution. There's no solution out there. There's nothing to do. Okay, your thoughts? Yeah.
You see, my own is this. You come into government, healthcare, education, water, light. You see those four things? Human beings cannot survive without it. Before you do anything, deal with those sectors. I'm telling you, if they dealt with the health sector, if they dealt with education, the way that we will look at government is different to the way we're looking at government now. Government are going to take the blame. You can say doctors, but doctors are human. They too must eat. Now, I was listening to a program yesterday or today. They say over 800 doctors have died from COVID. There is no
insurance plan or
nothing for them.
Nothing.
So they will just go.
Nothing to motivate the rest to stay.
They will even infect their families too. So why? If 800 have died, then that means more than that have had.
Exactly, because we really do not even have data.
Yes.
One day.
For me, I just think that, I remember when I think of my president is in England. Government people, they get ill, they go abroad, and it is, the president's wife was in Dubai, she said for health reasons, for over 6 months. 6 months. And your doctors are going on strike. It should not even. It should not even. Why are you not building hospitals? Why are you not? Look, all over the world, Nigerians have the best doctors.
Yes.
Nigerians are the best doctors all over the world. You hear this one has done this.
Michael, remember, did you go to Uyo with us? Where did you go? Do this
no doctor inside.
Hospital.
That's a taboo.
Now, I don't know.
No doctor inside.
I know that was then. I don't know what it is now. But then we were shocked.
You can see
so it's one thing to build. It's another thing to train and raise our doctors. You see, I want us to be a bit objective in this conversation because we can join the world in sharing the same sentiments we've been sharing. But how do we resolve them? I'm hoping that we can bring in our guests very soon to give us some real life solutions. What do we do? How can government meet us halfway?
See, it has to be whether government wants to do it or they don't. It has to be deliberate. We have 5% foreign, black doctors abroad in America. 2.5% of that number are Nigerians. So we know it's not lack of manpower.
5,000
it's not lack of manpower, that we have. But with our continuous abuse of sectors, you know that when Boko Haram was at the height of it, our soldiers were undermotivated. Now we have our doctors facing a pandemic. Whether or not, they are in the front lines, they are treating COVID itself. They have to face people with potential COVID cases in the hospitals where they practice. And now is the time you don't know what to prioritize.
Excuse me, I'm not a doctor. Every time they tell me somebody is sick, what do I say?
COVID.
I say it's COVID. When I got ill, I said I had COVID. So how can... and I didn't even test, but I said, no, I'm sure it was. Do you understand? So how can... So I am not in the front line, and I see COVID everywhere. What of those that are in the front line?
Yeah.
If I'm seeing COVID, they are seeing more than COVID.
Let me come to, I think our guest is here now, but let me just take your thoughts before I come to our guest.
Yes, so I think, our government is very good with comparisons. When they travel abroad and they see that everybody's paying tax in the abroad, they'll come here and impose tax. When they travel and they see that everybody is, things are happening in a certain way, people are paying so and so amount for fuel, and they even have fuel, they come here, they will increase it. Let them, when they go to those hospitals for their health care, I want to appeal to them to find out how much those doctors are paid, how much the health workers there are paid, how they are taken care of, their insurance packages, and when they come here, they should replicate it if they are serious about changing what is happening.
So, okay, I think you even answered your question, because the truth is that there are taxes. We abroad, there's some states that take about 40% taxes.
Yes.
Some states, but here in Africa, they are begging citizens to pay taxes. Listen, we can be objective and we can choose to be sentimental.
Okay.
If you look at the numbers of Nigerians, the workforce that are actually paying taxes, I don't have the figures here, but the figures are if you compare
They are
that to
below.
all the informal sector that we have.
yes.
So the truth,
But
I'm not, listen, I'm not making case. See, listen, I'll come to you, Lima. I'm not making case for the government because this government is not the kind of government they make case for.
Like,
Because
they
no
will
second you tell them,
disappoint you.
50%, 100%, they will disappoint you. So I cannot make case, and I dare not. But at the same time, I would like us to have that well-tempered conversation where we
Yes.
understand that we are clear.
Morayo, it would be good to listen to what I'm trying to say. So we're not saying we're not ready to pay taxes, but the people that are paying taxes,
No, we're not.
the people that are paying the taxes are seeing the basic amenities. We have money generated that government squanders on taking care of themselves. We see that.
Let's even
Why
talk
don't you
about
give us the
legitimate-
basic amenities and see if
Let's
Nigerian
even talk about
government
legitimate payments.
start from one place.
You see why I don't want to go to taxes? Because if I'm paying tax and I see what my tax is doing,
You will be
I will be very happy
motivated.
to pay.
Yes.
But if I'm paying tax and I'm seeing somebody get rich, or I'm seeing one local government chairman
Use up
coming
my
to
tax.
come and use my money to do, then I get offended.
Okay.
Now, I know that every taxpayer in England, when he retires, he or she retires, they have pension for life. One was free. They have different things.
Okay,
Healthcare. All these things are free.
Let me now
for them.
But
when they
Nigerian workers
go
are
on
paying
pay.
tax.
build on that.
Champagne.
Let me build on that. I remember because when I think it was the former governor of Lagos State, then I think it was Ashwaju that tried to increase the IGR of Lagos State. Then we're not even, the federal, we're depending solely on federal allocation. Gradually from, I think it was 10 billion to 30 billion monthly, gradually, I don't know what the figures are now. The point is, we that live in Lagos, we've seen the progression of taxpayers, and we've seen some of the amenities. We're not satisfied because there's influx of Nigerians coming in every from all over the country every time it's in the Lagos State. But the truth is that we have actually seen the difference in 1999 to now. If you travel outside and come back to Lagos, you will see traffic lights. The other time I came back to Nigeria, I didn't see traffic lights. I've seen traffic lights. As last one was established, the point is that we saw some progress based on taxes. I'm saying that if we, I'm just about Lagosians, if we pay our taxes, maybe. But a federal government as a whole is a whole different ballgame. Nigerians outside Lagos State, many of them are not paying taxes.
Yesterday in the papers, when we see
fault is
the
that?
debt,
Is it like
Exactly.
I'm going to have a conversation with both areas are taking responsibility, both government and we the people.
Excuse me. Before you can force somebody or impel or compel someone to pay tax, you have to, there is a way you will communicate with that person, and that person will feel compelled to pay tax. Now, if I'm living in the village and I don't have electricity because you
don't even know what is
there's
light.
no electricity.
Which tax are you
And you are telling me I should come and pay tax. I will be looking at you on what? At least in Lagos. Look, you have light in Lagos. Go to some other states outside Lagos, whether they have lights.
Let me go on a quick break. When we come back, we'll bring in our guests. Stay with us. We'll be right back.
Stay tuned. Your view will be right back.
Thanks for staying with us. So join us on the show now is a chief consultant, family physician, and the president Society of Lifestyle Medicine of Nigeria, Dr. Ifeoma Munye. Good morning, madam. Are you there?
Good morning. Good morning, friends. I'm here. How
Good to have you on the show. Yes. Now, let me start with the current strike by the resident doctors. What are your thoughts on this, and what do you know about the demands they're making and what the federal government's response is so far?
Well, it's very unfortunate that at this point in time, first of all, I want to thank you for having me on your show, your wonderful show that has such a wonderful outreach. It's very unfortunate that this is happening at a time where there is absolute need for good access to quality health care by everyone. The residents have a point they are making. I mean, I've been qualified now for nearly 40 years. I qualified in 1987. So I'm in my 30s of years after qualification. And I've worked in Nigeria and I've worked in the United Kingdom. And so I did my postgraduate training in the United Kingdom. So I have a good grasp of what it is to train and live as a doctor in the two different communities. And it's very sad. It saddens my heart to see what is happening to our younger colleagues. Tomorrow is April 7th and is the World Health Day, commemorated every year since 1950 to kind of draw focus and awareness and scrutiny to the constituency of the World Health Organization that says that every man and woman, every boy and girl, every child, everyone all over the world is entitled to access of excellent health care. They have a right to access to health care. But you see, no matter where you are in the world, so it doesn't depend on geographical location, it doesn't depend on your gender, your race, your color, your creed, your political beliefs, your economic status, your social status, you should have a right to access to health care. And tomorrow just happens to be the day, once a year, that this is celebrated. My question is, how do we describe what is happening in our country as a situation where every man, every woman, every boy, every girl, even the unborn child, has a right of access to health care? When healthcare workers, and in this case, my younger colleagues, are in such dire situations, you just don't even want to begin to understand that. And I think that it's quite timely that it's happening at a time where the World Health Organization is calling on leaders all over the world, policymakers, governments, to please create the enabling environment to see that this happens. So whether it means that the healthcare workers have better say, have better care, their needs are attended to, they are kept in such a situation that they can offer the good quality healthcare that the people deserve, that everyone deserves. It doesn't matter what geographical location in the world. This is a good time to draw the attention of our leaders to say, please listen to my younger colleagues. There is no, and many of them are leaving the country in the droves. At my heart, I'm just wondering who is going to be left to look after us. They are leaving, and because they're going to countries where they feel and they know that care is taken for those who are training to become specialists in different areas of medicine. So I think that this is a time to really draw the attention of our leaders to please pay attention.
All right, doctor. They say when two elephants fight, the grass suffers. And with this fight now between the federal government and National Association of Resident Doctors, it's the populace that are going to be suffering. There's a lot of queue in the hospitals. Nobody's attending to them. Even some hospitals that try to get outside consultants are not able to really attend to the mass of people that need to be attended to. So I want to ask you, do you think having the strike now is the best way to go? Because I know that in 2020, the strike happened about 2 times, in June and in September, and still we did not see any form of change, especially on the side of the federal government. So do you think this is the only way we can get the federal government to listen to these doctors?
Well, I think, I'm not sure what I think really matters here, but I think this. I think that people, everyone on both sides of the divide should continue to, and you're quite right. You're quite right, my friend, when you say that the masses are suffering. When two elephants fight, it is the ground on which they fight that suffer. Again, I'm going to draw us back and back to World Health Organization and what they say, that the health care must be adequate. It must be appropriate in quality. There is no way people are going to have this if there's fighting is going on. So I think that people should constantly be on the drawing table, on the discussion table, on the negotiation table to see that needs are listened to and met accordingly. So I think that dialogue must continue until we find a solution. Dialogue. When I trained, it wasn't as bad as it is now. When I did my MBBS at the University of Benin City, in Edo State, it wasn't this way. But I think towards the end there was 1 or 2 brushes of a strike or the other, and so on. But you see, I think the dialogue should carry on, remembering that the people who suffer are those at home, and for all you care. It may be our relatives, and many times it may even be our immediate families that suffer this. And if there's no doctor to help, if there's no doctor to work, then somebody will suffer, lives will be lost. So I think that the dialogue must continue, and nobody should be brushed aside. The leaders of the resident doctors must not give up. They must continue to adopt the negotiation and to talk. And government should please continue to listen. Continue to listen. They are our future. They are our future. I'm going to retire very soon, believe it or not. And we need younger ones to take charge of things. So I think that dialogue must continue.
Yeah. So you don't look it.
You just got out of med school.
Well, that's lifestyle. That's lifestyle, and God's responsible for that.
Okay, you keep referring to the World Health Organization, what health, what they consider basic health. Can you break it down? What constitutes basic or the best health care? What you consider the best health care? Because in Nigeria, even the HMO stop at malaria treatment.
Yes,
so,
sir.
what exactly is the access to best health care?
Okay. So I think the World Health Organization says that this healthcare that we must all aspire towards must be built solidly around a strong primary healthcare system, which is healthcare, particularly in the community setting and in the home care setting. And it is healthcare that is affordable, very important. And it's important to stress some of these things, because it's not good enough to say, oh, that organization, that facility, they have very good healthcare, and then you cannot access it. Then it's not in existence to the individual. Mm-hmm. So this basic healthcare we're talking about is healthcare that is good quality, appropriate in quality. So it's standard, it's global. Anywhere you go in the world, that stands, scientifically based and evidence backed. It must be accessible, like I said earlier. It must be adequate in range. So all forms of care, be it preventive care, be it promotional health, be it treatment, be it palliative care, all, be it other kinds of healthcare. And I dare add lifestyle medicine, which is now quite new all over the world. People must be made aware of it. Also, the healthcare must be acceptable. And this is what it's meant to be excellent healthcare service to the people.
All right, let's go on a quick break. When we come back, we'll talk about the risk of how to reduce the risk of chronic diseases with this. Stay with us for that.